You're listening to Happier, Healthier, a podcast presented by Conway Medical Center. In each episode, we bring you expert conversations and actionable strategies to help you navigate your health and well-being, fostering a happier, healthier life for yourself and your loved one. This podcast is made possible by the CMC Foundation. Their impact in our community is truly transformative. Think about this. Since 2005, the CMC Foundation has funded over $700,000 in mammograms for underserved individuals. They've invested over $200,000 in scholarships for CMC employees continuing education over the last decade, directly strengthening our healthcare workforce. And through the CMC Smart Snacks program, they've supplied over $559,000 in provisions to Horry County children. The foundation also provides crucial support like over $8,000 for cancer patient transportation. These are just a few examples of how they actively enhance the health and quality of life for individuals in our community. Welcome back to Happier, Healthier with Conway Medical Center. Today we have an exciting announcement to share with you. We have expanded our partnership with Coastal Carolina University, and CMC is now the premier orthopedic provider for CCU Athletics. Dr. Donovan Johnson, team orthopedic physician for CCU Athletics, joins us today to tell us what we need to know about this expanded partnership. Dr. Johnson brings incredible experience from his days as an all-conference college football player to treating elite athletes in the NBA, NFL, and serving as team physician for the U.S. ski and snowboard teams. Today, we are diving into what this game-changing partnership means for CCU's over 450 student athletes and the future of sports medicine in our community. So, welcome Dr. Johnson to the podcast. First of all, thank you for doing this.
You're so welcome.
We are now the premier orthopedic provider for CCU Athletics. Tell me, as the director of this partnership, Dr. Johnson, what does that mean?
It means a lot. I think it's a big obviously undertaking for the hospital to be the premier provider for CCU. It definitely is going to be a great thing for this organization, for our practice, for this group. I believe we started this group now roughly 5 years ago. Started off upstairs here on Myrtle Trace in a smaller clinic with 2 providers to now with, by the end of this year, 10 providers in terms of doctors, 5 or 6 PAs. So 16 orthopedic providers, so we've grown to kind of meet the need for the community. I think the next step, which is a common transition, is to meet the needs for CCU and their student athletes.
Yeah, so what will this look like for those athletes? How will things be different now?
Ideally, it's not going to be too much of a change from the previous, obviously healthcare that they had prior to us. And obviously those guys did a great job. So our whole goal is to kind of transition to be almost providers in the role for taking care of, sports medicine and injuries, those things, but not be too disruptive from kind of the normal flow for, taking care of student athletes. We as a group, obviously we're really excited about it,
What do you think the biggest change or benefit will be with this partnership?
Whenever, say any organization or a college, they switch over to a hospital system, I think there's going to be a lot of pluses for that transition. One being, not just being just orthopedic providers for the university, but the healthcare providers for the student athletes. And so, we have a system here that we have so many different other subspecialties from women's health to, endos and throat to, primary care to orthopedics to, any subspecialty you can think of, so that opens that door, to those extra resources. And so, ideally, taking care of student athletes is not just the injury, or they down on the field as assessing everything. It's head to toe, right? Mental health up to, just overall health. And so, just being a system in place that's over, the student athletes, we do bring a lot more to the table. And ideally, they will see that pretty soon.
Yeah, I think when we think of athlete ailments, you're thinking of a hurt knee or a broken foot, but you're not thinking of, the flu or even a virus can take an athlete out for weeks. So yes. That's huge.
Yes. And, being a former athlete myself, like I've been through it. I walked that path, I was fortunate enough to play, Division I football and had a few injuries, but, just being a student athlete for 4 years and 5 years in college is it takes a toll over you, and so I was fortunate enough to be, at an organization back in college where we did have a hospital system that kind of took care of us. So I saw everything, and it's just a phone call, and trust me, you will be in the practice that you need. But I'm excited for not just CMC Orthopedics, but CMC as a whole for this new adventure.
And for you personally, how do you feel kind of going back to college athletics?
I love it. It's funny how things are. Like, my first exposure to, athletic and sports medicine well, obviously it was an injury I had in college, and I was just so amused of how, my team doc at the time, treated me and it got me back playing within a couple of weeks. And so being able to, you know, be a former student athlete, taking care of student athletes on this type of level of competition, it makes it it's hard to explain, but it's a transition for me that will feel ideally natural. 'Cause I know when a kid is hurt, right? And so, because I've seen it, I've been part of it, but it's gonna be a good exposure for me in terms of for the next steps in my personal career. Is like I've always wanted to do this. It's part of the reason why I kind of came here to Conway was to ideally at some point be able to take care of higher level athletes.
Right. I talked when Dr. Phillips came on the podcast, we talked a little
Hmm.
bit about how for an athlete, your biggest fear is getting injured. I was a competitive figure skater my whole life, until I was like 18, so that's not my whole life, but a lot of it. And, my biggest fear was that if I broke something or even something small, that I would go to the doctor and they would tell me you can never skate again, take 3 years off. It was terrifying. I think
Hmm.
for athletes to know that their provider has been in their shoes is huge. Um, what does complete sports medicine coverage entail?
Yeah, it changes a lot. I mean, it's one of the more evolving, spectrums of, taking care of student athletes and sports medicine in general. Sports is a unique field where you got to consider everything for a student athlete from the position they play to the sport they play, um, making sure that they can compete at the highest level. And it takes a lot of team members to do it, and then it's just not just us, it's nutritionists. It's, sometimes, like we said, it's primary care, it's orthopedics, it's athletic trainers at the school, right? And so it's a team approach now that evolves and it's evolving so fast, especially with the dynamics of college sports in general. Um, it's it's one of the things that we have to consistently stay up on, as providers, as docs. Constantly know the new rules, the new changes, constantly being informed about some of the changes from even just the conference level, right? And so we as a group, I think we got the personnel here to manage it pretty well, right? And because, just from the surgeons in our practice to the non-operative providers to, their different backgrounds and what they do, and they bring a different kind of conceptual idea of how sports medicine works, and so my whole intention is to actually take it to that team approach, and that's the best way we can do the best for the student athletes.
And will you all be on the sidelines or, at the games?
As much as possible, yeah. So ideally for, most of, college sports, you always see the injury tent, you always see the doctors on the sideline for the big games, football game, basketball games, we'll have a team of 5 providers. So, we should be able to cover most things for most sports that they deem that they need, assistance and help with, and so the whole goal is to be there, be present, be active, right? But also allow, the current, trainers and the coaches to kind of do their things, and then we there if they need us.
So with your experience, I know you have experience working in leagues like the NBA and the NFL. What specific resources and protocols will CMC bring to CCU's athletic programs that kind of reflects those best practices of athletes at an elite level?
Yeah, that's a great question. We intentionally tried to, recruit, providers that had exposures and experience from different things. From personally for me, I was fortunate enough to cover, college back in as I was back in Tulane, the coverage at D1 school, and all of our team members has that experience, right? And so it takes experience to be able to understand and be able to offer the services that kind of what the expectations, what the universities expect. We as a group, has that experience. It was just waiting for the opportunity to come, and as you can tell, I'm pretty excited about it. I think it's going to be a great thing for both parties and both, organizations from CCU to CMC. The next step for us is, getting boots on the ground and, starting day one and, and addressing the needs and ideally fulfilling the needs for the university.
Yeah, and long term, what is your vision for this partnership? Like, how do you see it evolving?
To keep growing, keep expanding, keep building trust between both groups, right? Ideally, long term for us is going to be a long term partnership that both, organizations will obviously benefit from. We are excited about it. That's the only way I can put it. I mean, we've been waiting for this.
Yeah,
So,
I'll ask you one more question. What is kind of, if there are Chanticleer athletes or coaches or even just community members, fans listening, what is your kind of message for the Chanticleers going forward and kicking off this partnership?
yeah, the biggest message is just to trust us. Know that we have a very skilled team to meet the needs for the university, meet the needs for the community, meet the needs for, anyone in, this Grand Strand area. Just trust that we're going to do a good job, take care of those kids, keep them active, keep them on the court, keep them on the field, keep them competing, right? And I think, it's going to be a good partnership.
Awesome. Well, thank you for doing this.
That's it for this episode of Happier Healthier. We appreciate you tuning in and hope you gained valuable insights for your health journey. Again, thank you to our sponsor, the CMC Foundation, for allowing us to bring you this information from experts for free. Discover more about the CMC Foundation's vital work in our community and how you can contribute to their mission by visiting cmcfoundationsc.com. That's cmcfoundationsc.com, or find the link in our show notes. And just as a reminder, all content discussed on CMC's Happier Healthier podcast are the individual opinions of our hosts and guests and should not be construed as personalized medical advice. By listening to this podcast, you agree not to use this podcast to treat any medical condition for either yourself or others. Consult your own physician for any medical issues you may be having. This disclaimer applies to any guest or contributor to the podcast. Be sure to subscribe so you don't miss our next episode of Happier Healthier, proudly brought to you by Conway Medical Center.